nature's best bobtail.
That's right, Liesl. Now, as you know, we love our pets here at Expresso, and we want to educate you on taking the best care of your pets. And our celeb vet, Dr. Roy Aronson, is back with us talking about dog hotspots. And now is also your chance to phone in and ask your pet-related question. 083-9133728 is that magic number. Dr. Roy, welcome back here.
Thanks, you.
So we are talking about dog hotspots.
Yes.
Firstly, what exactly is a dog hotspot?
Well, it's a red, raw and very itchy area that is really quite painful. Hotspots can be really quite small. They can be about the size of my thumbnail, and then unfortunately they can be about the size of my hand, and they really, they're sore. The dogs are itchy, they worry themselves, and it's also painful.
Yeah.
So they really do need some help.
So I mean, how do you recognize it? If you're at home, you have your dog.
The dog is generally scratching, uncomfortable. There's a spot, there's an area on his fur which is clumped, and he's very uncomfortable and scratches it, and there's almost like a scab-like area on his skin where you can't, the fur is clumped.
Yeah.
And it can be quite smelly. There's pus underneath the fur.
Okay, so you would recognize it
they
if you
need
see
to
it.
be treated.
Cool. So we have a caller on the line. Veronica, good morning.
Hi, good morning, Ewan. How are you?
I'm very well. Nice of you to phone in.
Yes, thanks. I really need some advice from Dr. Roy.
Ask away, Veronica.
Good morning, Dr. Roy. How are you doing?
Morning, Veronica. Yes, well, thank you, and you?
I'm fine, thanks. Dr. Roy, we are integrating two homes. My sister and I are moving in together. We've successfully introduced our dogs to each other. The problem is I have a Siamese cat. And how would I successfully introduce my cat to her dog with the least trauma to the two of them?
Very, very, very slowly and very carefully. Unfortunately, dogs can kill cats if they're not used to them. And cats, if they're not used to dogs, will run away. And when the cat runs, it presents a moving target, and the dog will hone in on that. So you just have to be very careful, very cautious, and make sure that you never allow them to integrate by themselves. You have to be there at all times. Yeah. Supervision.
All right.
And also maybe look for the advice of an animal behaviorist or someone like that, that can really help you as well.
But supervision is critical.
Yeah. Perfect. Thanks,
I hope
Veronica.
that helps.
Cool.
Yes, we've just wondered, should we have the dog on a leash when we introduce him, or would that just make him more aggressive or territorial?
Dogs on leashes sometimes want to pull, so you just have to be cautious. I think I would pick the cat up and have the dog off a leash. But once again, be careful, because cats can go crazy if they get scared, and they can scratch you and scratch your face. Then you drop the cat, off it goes, and off the dog goes. So you really have to be very cautious, take your time, and be very careful. And consult a behaviorist. I think it's a very good idea, Ewan. Yeah, excellent.
Cool. Thanks, Veronica. Appreciate it.
Thank you.
So just to get back quickly to the hotspots, once you've diagnosed it, I mean, what are some of the treatment options?
Well, we bring them into our practice and we sedate them because it is painful. We sometimes even have to anesthetize them. We shave the area. That's really important. Get the matted fur off the spot, and then you can bathe the area. We use drugs to suppress the itch and irritation. We cover with antibiotics. So it's quite a complicated business. But let's, for instance, say that you're out somewhere and you don't have access to a vet. There's some things that you can do. First of all, prevention. Hotspots are as a result of something biting the dog and inciting an itch. So control external parasites like fleas, ticks. Make sure that nothing is biting your dog. Then if your dog does have a hotspot, what can you at home do if you don't have access to a vet? And I want to say my first instruction is take your dog to a vet. It's really sore, it's uncomfortable.
Okay, awesome. Now we have one more call on the line. Rena. Good morning, Rena.
Hello, good morning.
Morning, you well?
Morning, Rena.
Yes, I would like to know, I've got a cat which bites off the hair right from his neck down to his tail, virtually bites it off right onto the skin, and then it makes like little sores, and quite broad, about 10 to 12 centimeters. We took him to the vet years ago, and they gave him hormone tablets because it was ever since she was sterilized that happened. So the hormone tablets worked, but we had to stop it after a while because it gave liver problems.
Okay.
And now nobody knows what can we do, and he's still biting hair.
Rena, there are very many reasons, but I'm going to zone in on just two of them. The first is that he may be itchy and having an allergic reaction, and he's scratching himself. And the second is there definitely are behavioral abnormalities. You know, some humans bite their nails and some cats pluck their fur out of their skin. So behavior is a very important thing. You need to, if there are other cats coming into the environment and stressing him, then he may respond by pulling his hair out. There definitely are drugs available, and you need to make sure that you take him to a vet and let the vet have another look. And if you don't get satisfaction, maybe you need to just get a second opinion. But certainly there are lots of things that you can do.
Awesome. Dr. Roy, thank you so much, Rena. I hope that answers your question as well. Really appreciate you joining us, Mr. Irish Dr. Roy Aronson.
Or Aronson.
Or Aronson, that's it. So I hope you guys are. So catch Dr. Roy next week, Friday, again, and then you get the chance to call him again and ask him that pet-related questions. Right now, though, Kia and Leanne announced or told you about our Happy Friday competition where you can win a 2,500 voucher to any Protea hotel in South Africa. And right now, we're about to choose a winner.
Stay with Expresso and SABC3.